My name is Dr. Calvin Smith. I'm a general practitioner at Nashville General Hospital affiliated with Meharry Medical College. Have you heard about the COVID-19 vaccine? If not, let me tell you more about it. At the beginning of the pandemic, we were asked by our president, Dr. Hildreth, to take the lead in terms of initially just testing and treating those that were infected with COVID-19. It was a very scary time. It was a time of a lot of uncertainty, but we knew that we had the leadership from somebody who was trained very well in virology. I was following pretty closely to make sure that things were safe and effective. Given the history of things that have occurred in communities of people of color and specifically African American people, it was very important to me to make sure that I did my due diligence in terms of vetting what was coming out in terms of vaccines, in terms of treatments, et cetera. And what initially had me on board with the vaccine was the fact that a lot of the science from the vaccine was based on stuff that was done previously. So what we know now about COVID and the coronavirus is that we've seen these kind of viruses before. The MERS virus, Middle Eastern Respiratory Syncytial virus, the SARS virus that occurred in Southeast Asia. These things have happened previously, and they are very similar to how COVID-19 acts. And so the science existed previously. And I think that was the first thing that I wanted to make sure I emphasized to my patients, to my family, that this is not something that's coming out of nowhere at light speed, even though they called it Operation Lightspeed at the time. This is based in real science, real safe, sound logic. As time went on, and we had involvement throughout the city from various entities, including where I worked, I felt very comfortable in knowing that this vaccine that was going to be coming out was going to be tested, was going to be fair, was going to be ethical, was going to be distributed in a way that would affect everybody, but especially those who were the most profoundly affected. By the time the vaccine came out, we knew that people of color, people of low socioeconomic status were the ones that were mainly affected by this particular virus. They had the most severe and deadly outcomes, and they were the ones that were most vulnerable. And those happened to be the patients that I happen to see on a regular basis. So it was near and dear to my heart to make sure, again, that we were doing the right thing by those people. And I include myself in those people. Would not even to dare to venture to ask anybody to get something that I wouldn't already get. I've already gotten 4 doses of it. I think that this is going to be kind of our regular way of life now. We don't have much control in it, but what we can control, we ought to control. And the vaccine is a form of that.